Abuse of prescription painkillers has been on the rise in recent years. What you may not know is that the number of women overdosing on prescription painkillers has increased 400% in the last 10 years. It's a staggering number. Ed O'Reilly is the program director of the Neil Kennedy Recovery Clinic in Dublin, and he's here to share more. And I cannot believe that statistic. Welcome, by the way, but wow, that is a staggering statistic.
It is. To be honest, I think everybody in the field was a little surprised. We all knew that we were seeing increasing numbers of women with problems, but the differential is pretty alarming. It's yet another way, I think, in which women are sort of catching up to men in ways we would rather they not.
When we talk about these painkillers, Ed, what kinds are we talking about? Obviously, some that are very addictive.
Yes, the common ones, what we'd be talking about would be Percocet, Vicodin. Most people have also heard of oxycodone. So those are the ones. Anything that's opiate-based tends to be potentially problematic.
You've seen an increase. Obviously, the CDC report said 400%. Why is this such an increase, and why for women?
Well, as we pointed out, it's a sort of an across-the-board increase. But why more for women, I guess, is the key here. And to be honest, nobody absolutely knows for sure. There's some informed sort of speculation. The idea is that over the past decade, doctors have been encouraged to pay more attention to women, which is a good thing. But also over the past decade, doctors have been much more liberal about prescribing opiate-based pain medication. So this is not a good coincidence here. Pay more attention to women, give them more opiate-based pain medication. The other thing that happens is that women also very often tend to be prescribed anti-anxiety medication more than men do. The classification of medications called benzodiazepines, that's Librium, Valium, Xanax.
Right, okay.
And those are especially problematic if you mix them with opiate-based pain medication. In fact, it's a relatively quick way to kill yourself if you're not careful.
Are doctors not giving women, or men for that matter, when they give these painkillers, enough information about what can happen?
That's hard to say. I mean, I wouldn't want to jump the gun and say doctors are not giving enough information. They might be, but I don't know about you, but sometimes when I go to my doctor, he says a lot of things.
Okay. Unless you write them all down.
Right, unless I write them all down, I'm kind of selective in what I remember when I leave. And so it could be some of that. I don't want to place the blame all on doctors for sure. Patients are kind of notorious if you talk to doctors about not paying attention to what the doctor says. That said, however, it is pretty evident that at the beginning of the decade, doctors were probably not aware of the fact that these opiate-based pain medications have a high addictive potential. Certainly not as high as it turns out, and sort of a liberal prescription of these things has been problematic.
How can we help these women then, and men? You keep forgetting about the men because we're focusing on women, but how can we help these folks who get addicted to painkillers?
Well, one of the things to remember about painkillers is it's not everyone will become dependent on them if you stay on them long enough. We're not talking about addiction there, it's just physical dependence. That's not necessarily a problem.
Good point.
The addiction is when you have negative behaviors that are associated with the use and you keep using. One of the things to look out for is if when you take pain medication, you notice that it does other things for you. It kind of sands the rough edges off life, maybe gives you a little bit more energy to do more housework or more work or something like that. If you notice that they do that, that's a warning sign. Right? Be very careful. Okay. The problem, of course, is it might be a warning sign, but it sure does feel good.
and another warning sign, I know, and you're right, it's kind of hard to take that good feel away. If you start doctor shopping, if your doctor says you've had enough of these, you just keep going to other doctors, that's a sign that there's a problem. Women
tend to do that more than men, as a matter of fact, and I think part of the reason for that is because women pay more attention to how does it look.
That's interesting. We've had your information up there, and if there are women out there that see anything resembling what they're going through, they should give you a call.
Yes, absolutely. Like most, addiction is a chronic disease, and like most chronic diseases, the earlier you catch it, the easier it is to treat, and the more successful the outcome is. So the sooner the better, absolutely.
And great information, as always. Nice to see you again.
Nice to see you, Gail.